most people that have had a back injury, even though they might think it's a new injury, it's been going on for a very long time, most of the
Yeah.
time. Most of the time, it's acute on chronic. So when we do get those MRI results, it shows that these changes have been happening over a long period of time, because you wouldn't see those changes in the tissues and those changes in the bone structure if it were really as acute as they think it is.
Usually what the biggest misbalance I see is where people have worked on one area, not the other, and there's a lacking of control or lacking of strength, whichever one they're not working on. And so they either got great control when they've got admin ability to have capacity to have good load, or they've got really good strength but no stability control.
I think people forget that they migrate to an area that they like, right? Either it's strength training or it's flexibility training, or it may be a combination of activities, but you really need to make sure that you're including all of them, which would be flexibility, joint mobility, strength, muscular endurance.
Hi everyone, and welcome to the show that helps you become more confident in your body so you can keep doing the things that you love. My name is Michael Dermansky. I'm one of the senior physiotherapists at MD Health, and I have a special guest with me today from Massachusetts in America. And she's a physical therapist over there. Her name is Karen DeSimone. And we're talking about the topic of freedom from back pain, why thinking long-term makes a big difference. Karen, welcome to the show and across the other side of the world.
Thank you so much for having me, Michael.
No worries. I mean, how long have you been a physical therapist for?
Working on 27 years now. I'm almost at my anniversary. Yeah.
27
20,
years. Sorry. What year did you graduate?
2000.
Right. Okay. I beat you by 2 years. I finished in 98. So I've been doing this for a bit long, about the same time as well.
Yeah. So you're an oldie with me. Thank you.
Well, I think it's interesting because we've had separate, but we're actually not that different a path as well. And when we were talking about this topic yesterday, it was amazing how similar some of the journeys were. So I wanted to ask you a question from there. Working as a physical therapist, and I'm going to use the word physical therapist for us in Australia because we physiotherapists, exactly the same profession. You realize that physical therapy wasn't enough. What does that mean? What does that mean from a client point of view, from a patient point of view?
Yeah, that's really interesting, because it was such a, winding road to get where I am today. And that's why I'm sharing what I do. But I realized that there was a gap between when people were discharged from physical therapy and we either achieved their goals and they left for a little while, and then cyclically, it seemed 3 months, 6 months, a year later, they would come back with the same issue. Or we weren't able to resolve their symptoms enough, their radicular pain, their pain in their arms, their legs, their neck, where their low back, or they weren't able to return to function, so that they required surgery. So, and they was like, okay, this is as far as we're going to be able to get. And they would go on to surgery, or they would feel like they got their result. They would leave, but they would almost always come back at some point in time. And I started looking at that gap of people and trying to see if there was something else that we could figure out for them, so we could help them actually achieve an outcome and sustain it long term.
So what did you find? What was this gap? Because I
I
mean,
found Yeah, I found that, at least in America, our model is broken, and we are more and more looking for masking symptoms rather than resolving it at the root cause. So I
yeah,
looked at things outside of physical therapy, and that did several things for me. One, it allowed me to open the door for a cash-based service model and make
yeah,
it a hybrid, so I didn't have to give anything up. I think a lot of physical therapists want to do cash-based businesses, but they are afraid to make that transition because they feel like they have to give up everything they've worked so hard for, including their customers who they want to continue to serve. So this
yeah.
was, for me, the perfect balance of being able to keep things the way they were and migrate over to this other system. In addition, it wasn't exclusive. So that
Yeah.
worked out really well for me.
It's interesting you say that too, because I remember when I started my first practice, and this was 2002, quite a while ago. And the typical model was 4.2. Actually, I kept stats on the stuff, and the industry average is still around 4.4 to 5.2. So I kept stats on how many clients came in, and then a good outcome, like they sort of got what they wanted, was 5.1 visits or something like that. And a bad outcome was they had to leave because they weren't getting better, they needed further treatment, whatever it was, something different. It was 4.2. So this is almost identical. And like, this was crazy. Like, this is, like, they weren't getting it, they weren't really changing. And it was about the time, in Australia anyway, that a lot of the research coming out of Queensland was about cost stability stuff. So I know people like, Glenn Joel and Julie Hyde were doing all, and first name, but, and then Peter O'Sullivan as well in Perth as well, were doing all this research on cost stability. And they were doing this stuff like working on multifidus and working on the size of multifidus activation or transverse dominance, which are all the deep core muscles, which everyone talks about core now, but at the time it was fairly new, and showed that if people had full control activation of these muscle groups, the chance of recurrence are very high. So, even though the initial symptoms will resolve, the chance of recurrence was 70% over the next 12 months. And then when they worked on these muscle groups, so when the pain went away, these muscles didn't come back automatically. They didn't, they just stayed off. And so they were the areas of vulnerable injury. And so the reason why the vulnerable injury was because the movement of the joints was excessive. It didn't allow the control that should be there. So that's what we talked about, cost stability. And so if we improve that, it reduced the natural glide and slide of the joint. So reduced the load on pain sensitive structures, and the reduction in the the reduction of chances of recurrence was down to 30%. So a 2.5 times reduction in recurrence over 12 months. Like, oh my God, we've got a way of doing something about this. There's something out there. We don't have to wait for someone to hurt themselves and just wait. We have more options as physiotherapists. And, I saw the same patterns in early 2000s. And so why are we sending people out to hurt themselves again? We can do better than that.
Yeah, that's an amazing statistic, and when you look for solutions, you'll find them. And I think a lot of times people focus on problems rather than focus on how can I do things differently.
Yeah.
We follow a model, and just because the model's been around for a long time doesn't mean it's the best model. And I
No.
believe we can always do better as long as we're
Well,
always striving for better.
Well, you talk about the back journey that you think pretty well, but I think, you got to think about where the lot of the model came from the physiotherapy community. It came from the hospital model where we got limited resources. And so we've got X amount of dollars, we're going to get an outcome in this amount of dollars, and that's all we've got. So let's figure out what we do. Give you home exercise programs, we'll do this, and then we'll go to the next person because we've got a waiting list that's this big and we've got this many resources. And that's what we have to do. But then in the private sector, you don't have the same problem anymore, but the mentality hasn't shifted. So
Right,
we're
and
still
that's what
creating.
I do, is that we're creating plans of care around how many visits are approved or how many visits the patient is allowed for their particular insurance,
Yeah,
instead of saying, "What does this person situation require in order for them to reach the outcome that they're
yeah,
seeking
sure.
and that we're able to achieve?" So we're looking at it a little bit backwards, and I think, again, it all comes from following a model that isn't necessarily designed around outcomes.
I mean, it's understandable. Limited resources, high demand, low supply. You have to do something, but it's not around outcomes. It's not around the patient centric. It's about what they had at the time. But it was just then assumed that was always the case. But that doesn't have to be the way. There's no reason why it can't change.
That's right, I agree with that, totally.
From your point of view, when you see someone for a back injury, even though it may have just happened, usually there's a bigger picture. What have you found?
What I've found is that most people that have had a back injury, even though they might think it's a new injury, it's been going on for a very long time, most of the
Yeah,
time. Most of the time it's acute on chronic. And so when we do get those MRI results or diagnostic testing, it shows that these changes have been happening over a long period of time, because you wouldn't see those changes in the tissues and those changes in the bone structure if it were really as acute as they think it is.
yeah.
That's really a recurring theme I see all the time.
Yeah. Any particular findings that when you do clinical examination that you've found with people that have got the acute episode, but the more chronic symptoms that you're finding on examinations?
Yeah, and I think that they don't understand. I think a lot of the times they don't understand what's going on underneath why they're having their pain. They just know they have this symptom, and they oftentimes don't relate a ridiculous symptom, pain and or numbness and tingling in their arm or their leg, that and don't have back pain or neck pain. Then they don't even associate it with the pathology that's going on in the central nervous system somewhere or in their bony structure within their spine. So that am amazed at, that no one's ever explained to them before what's really happening and why they have that symptom, and they're so disconnected. And they'll say to me, oftentimes, well, I don't have a back problem, I just have tingling in my foot. And I'm thinking to myself,
Uh,
there's some education that's lacking here, and that's where we start.
yeah, interesting as well. And, we've found as well over the years as well that, we can see this thing from come a mile away. Like, it's not hard to see where they're coming from. So,
Mhm.
as you said, someone hurts their back. Oh, I hurt my back. I lifted this. But, and we had a client here. Probably he's been here for about 4 weeks now, but, he came to see us like, "I lifted this in the gym, but I've had," and I hurt my back. And when you go into history, like, "Oh, every 6 months I'm lifting, doing back pulls in the gym, and I lift and I hurt my back and I stop for a while and then I come back again." And when you do his assessment, like, his back stabilizers are super weak. His glutes are super weak. There's lack of movement in his hip movements as well. There's a lack of hip control. So all the things that should have been set up to give him the capacity to be able to lift and do these things weren't worked on. And then he does one day something that's a little bit more. He puts load on a pain sensitive structure. He hurts this in his back. He feels that. But the setup has been happening for years, and it's just they see the last part of that straw, not the very not the other parts as well. Where when we do examination with someone, as you found out from the other side of the world, we can see it a mile away. Like, it's, okay, weak glutes, quick core stabilizers as well, poor mobility as well, lumbar spine as well, poor mobility in the hips as well. Like, this is only a matter of time, and then you just need an event to be that higher level, and then bang, we've got an injury.
That's right, and because we're the model is designed to chase symptoms, and once the symptoms are resolved, we feel like, "Oh, it's time to discharge," when that's really where the work when the work begins.
Yeah,
Because if we're going to truly resolve it, then it goes much deeper, like you were just saying, to work on
yeah.
those other areas for the stability and the control, and if that doesn't happen, they're setting themselves up for something down the road, and isn't it interesting, physical therapy, at least in the United States, has this discharge framework of, okay, they're discharged to someone else when I believe that we're probably one of the best clinicians to help them down the road. And instead of them going to a personal trainer or going to a different instructor, why aren't we helping those people past discharge from a traditional physical therapy insurance based model to something more sustainable? Because these people are asking for our help and we're just, seeing them at discharge going, okay. And then oftentimes they'll say, okay, I'm going to go back to my trainer or go back to the gym when that's when they really do need our help for the specificity around what it is that they need to be doing to resolve those issues like you were just talking about.
And
I think
and
that's
then
very interesting point that we need to continue to explore and maybe insert ourselves in so that we can have recurring clients rather than discharge them and wait for them to come back.
yeah.
They're wanting our help, they're needing our help. We need to offer our help and take it from a different perspective.
I mean, I saw this 50, was it 20 years ago now over that. It was insane. Like, you treat some of the acute symptoms, and then, like, they're patched up, you're giving them a Band-Aid, they haven't really gotten better yet, and then you pass them on to someone less qualified with less knowledge to you, that hopefully they'll do the right exercise so they don't hurt themselves again. Like, why are we doing that again? I'm confused. We know what they need to do. We want to do that with them, but we pass them on to somebody else who's less qualified and less knowledgeable? Huh? How does that system work? That never made sense to me.
Right,
You
right, I
know,
agree.
yeah, and
Again, it's
one of the big
following a model that it's the only model we knew of, so we just followed along without questioning, "Is this the best model?
yeah,
Is this the best for us? Is it the best for our clients?" And we just accepted that this is how it is. But again, we never questioned what would be better, how can we better serve? So I think that's a great question to always ask ourselves, "How can I serve better?" How
well,
can I help?
the big question I always had as well is that, we all did exercise physiology as a subject, and we learned about growth and strength training and all that stuff as well, and I'm sorry, I don't know which textbook ever has ever said, "Well, you're gonna build muscle strength in 5.2 sessions."
Yeah,
How long does it take to build up, initial changes in muscle strength? I mean, the first 7 weeks of any exercise program, you go to the gym is neurological adaptation. So you make better nerve connections to the muscles. You get stronger, but the connections form, and growth only happens in the first 3 months.
that's right. That's right.
So, well, if you go to the gym and you expect to get stronger over 3 months, what are we doing? What are we doing in the rooms?
Right.
I don't get it. Like, this is how long it's going to take to get better, but we give people that part of it, and then like, well, hope that stuff happens outside of here that will give you all the other, 10 weeks of what will happen outside that needs to happen in order to be for change. Like, let's ignore physiology, ignore the first few chapters of every musculoskeletal book, and just try to cause miracles to happen. Like, I don't get.
It's a good, great question.
It's a great question. Like, why are we ignoring physiology? Like, why not work with it as opposed to against it? We know what people need. They need to do at least 3 months of strength work. If they don't do
Right.
3 months of strength work, they're not going to get the change. And you don't go to the gym for 4 weeks and wonder, well, why am I not stronger? Because you haven't done enough. It's as simple as that.
Yep. And it's the perfect rationale for creating a new model, right?
Yeah.
Right. One designed around the outcomes and, like you said, with the physiology and the evidence to support what it is we do and why we're doing it and the best pathway to get there.
So let's talk about you. From your point of view, what's a good long-term patient journey look like? From the start to the end. So they come to you, they've heard their back. What does a great
Yeah.
program look like?
So the very first thing I do is find out what they want. I think, that's an often very obvious missed point. What do they want? What do they want their life to look like? I think, especially with chronic pain, they've lost hope sometimes, and
Yeah.
especially in a person that's of a certain age. They've bought into the idea, which I don't believe in, of that the age is a limiting factor, and I'm never going to accept that as a philosophy of mine. It's
Yes.
If you think about it, it's your life has changed and you stopped doing the things that kept you strong and flexible because life got in the way sometimes of doing those things, or you lost interest in those things. So I think the changes that happen throughout our lifespan are directly impacting the outcomes and the issues and problems that we sometimes find ourselves in because of the choices that we made. So first of all, make better choices to have better outcomes, but really finding out what the person wants. What are they not able to do? What do they want to be able to do? And really instill belief in them by the belief that we have. I think we underestimate the power of belief. First, we have the belief that we can help them achieve the outcome that they want. And then we educate them and help them to regain that belief that they can do it. If they follow the pathway that you've outlined for them in a specific way and they're willing to do what it takes, meaning to be your partner in this. It's not all up to you. Come to me and I'm going to fix you. It's
Yeah.
you have to make the right decisions when you're not in the clinic. So to educate them and work around that and help them through that from the beginning to the end. And then work on milestones. Set them up for success. This is what to expect. This is what you're going to probably experience in the first few weeks, in the first month or two. And then this is when we help you return to function. This is what you can expect for the long term. And this is how you're going to maintain and sustain the level of success that we've been able to achieve over these last 1, 2, 3 months. And so I think that's a successful pathway for the client to knows up front and then knows the pathway throughout the duration of it. And then it's not really a discharge, it's a maintenance program so they can continue on and be successful and maintain their function
And how
beyond.
long?
Yeah.
What are the rough ideas of some of these milestones from your perspective?
Well, first of all, if it's an acute on chronic, we want to, minimize the acute pain and inflammation that they're having. So we want
Yeah.
to make sure that we calm the tissue down, if you will, and make
Yeah.
sure that they understand. And again, we go back to the understanding and the education. They have to understand what is going on within their spine and what movement patterns are causing that to be worse and what's helping it to be minimized. And so oftentimes we'll spend a session or two just talking about positioning to help alleviate some of those acute symptoms. And then they're not relating their activity, sometimes a static activity like sitting or lying down, they're not directly correlating it to how they're feeling. And oftentimes, as you know, when they're moving about, they might not be feeling something, but when they lie down or they sit down, then they're feeling something that they don't want to be feeling, right? They're worsening of their symptoms. So it's a lot of education around that and then helping them navigate through that and starting identifying what those things are. So that's really the first phase of it. And then as we're doing that and as they're able to move more, and in the first phase, we're realigning the tissue. We're realigning, if there's a problem with, say, the back, we're realigning facet joints, and we're helping the discs heal, and we're helping nerves heal, and we're helping all of those structures return back to normal. So that's really the first phase. And then we're getting more into more of the stability and mobility in the second phase. And then in the third phase, we're really talking about back to function and strengthening. So what you were talking about is really in the middle phases of working on stability at the core, right? And
Yeah.
postural deficits, pelvic stability. And then I think often overlooked is segmental mobility as well. How is your spine segmentally moving? And are
Mhm.
we able to control it to move independently of other things? And so first we need the mobility, and then the segmental mobility on top of that too. So all of that is all happening throughout the course, and we're looking at those things along the way to say this is readiness for the next milestone or the next progression of activity or exercise or stability, whichever phase we're in.
Yeah, and you do have a rough idea of timeframes that people are looking at? I mean, I
Yeah,
tend to
depending
find
on
that.
the chronicity of it and the severity of, how symptomatic they are, most people finish in 12 weeks. The
Yeah,
frequency of being in the clinic and out of the clinic varies, but it's a weaning them away from being in the clinic. So you might say a 3 time a week frequency in the beginning, and
yeah,
then we'll drop down to 1 time a week frequency toward the end. And then we might even do every other week if the person's getting back to really high level function to make sure that they're able
yeah,
to return to that. I have some triathletes that, come to see me, or runners or
yeah,
cyclists. So we want to make sure that they're able to return to those without recurrence of the symptoms. And then oftentimes I'll have them come in once a month after that, just for 3 months, so I can say, yes, we did achieve it. Yes, they're back to activity, and they continue to feel better and better even after they might not be coming in the clinic. And I encourage them to continue coming once a month after that, and always be doing the core exercises, if you will, not even for the core, but core meaning the ones that are fundamentally important for
yeah,
them to always be doing, because once this is human nature, once you feel better, you stop doing the things that helped you feel better. And
yeah,
that's again one of the gaps that we really want to bridge and make sure that people do that, but give them a community to do it in.
yeah.
I think that's lacking. We're not providing a community for them to do it in, so they're doing it on their own. And my clinic, people are so friendly, and they help each other, and they're always looking out for each other. So I think they like to come back. So that's always fun to see how is so and so doing. And due to HIPAA, they'll say, well, can't really say, but they'll see each other.
Yeah, absolutely. Look, I mean, the two things of that too. Number one, it's not a random number. You said 12 weeks, so it's not plucked out of the air. That's how long it takes to get your healing occur. Like, it's simple as that, and muscle strength change. Because we have a 13-week program. You said 12. Like, we're almost on the same numbers here. And it's not random. That's the first few pages of the exercise physiology book that people ignore. And so they're not random numbers. That's how long it takes to get change for that body to adapt. And so we're just letting the body do its job and giving it the volume and time it needs, rather than not doing that and wondering why the outcomes aren't there. And I have to highly agree. I mean, we also see give people a community. They want to talk to other people in the same boat, and they feel like they're supported that way, not just from you, but from other people. And then that
Yeah,
means I'm on my
that's
own.
right.
It's not, someone is there doing the same thing.
And I think a lot of times, at least I know for me, when I was a younger clinician, I might not always be, and I'm pretty straightforward. Some people might disagree with me, but it's not always easy to tell someone what they don't want to hear.
Yeah,
And taking away something that somebody's really passionate about doing is challenging sometimes, because you build a relationship with them, and of course you want them to like you, but you need to be helping them at the same time. So you're not necessarily helping them if you're not telling them that the participation in an activity at a certain point in time is only going to set them up for failure, and it's
yeah,
going to prolong their ability to return to the very thing that they want to be able to do. So, I've learned over the years to have those conversations up front, and make sure that they are going to be able to follow your direction, because that's a very important partnership as well, for them to buy into following that direction, knowing that you have their back, knowing that you're not doing it because you don't want them to. You're doing it so that you can help them
yeah,
return. So, making sure that you're not just trying to be their friend, but you're helping them and mentoring them back to the very thing that they want, which is to be free and to enjoy their life.
Yeah, and there you go. There's a really big thing. The reason why we do this job, why we do, the work with clients, to get them to enjoy their life. That's why they come in to see us, because they want to enjoy their life again. And this is a tough conversation we have with our new staff members as well. When they first start, our job is to find out what people want to achieve and get them to do what they need to get the results. What does that mean? It means sometimes tough love and telling people things they don't want to hear, because they're sometimes doing things to sabotage their own outcomes. And we can see that a mile away, and we want to make a difference to that. It's like, okay, you're not coming in as often as you should be. You're not doing the work. It's great that you feel better today, but you've gone and done gardening for 3 hours afterwards too. Your body is not ready for this. And that's why we're going back and forth like a yo-yo. We shouldn't be having this happen. You're not ready for this. Give it 2 weeks, no problems at all. But right now, you're just not ready. There hasn't been enough time. And, that's it. It's much easier for us older people to do this. But the junior guys struggle with that sometimes. To have
Yeah.
those tough conversations that you're actually not helping yourself.
That's right. That's absolutely right.
A lot of your patients stay with you long term, often after their back pain resolved. Why? Why have they chosen to stick around with Karen after their problem has settled down?
Well, I think a lot of it I already spoke to is the community that we've
Yeah,
developed and the trust that we've developed for each other. The respect is there as well. I really believe that anyone that works at what they want and is willing to take the right direction can have what they want to achieve. So a lot of times when we're done helping them, like you said, it's going to take them even more time to build those postural muscles, the stability beyond when they're even done with me. So we want them to come back, and they know this because we've explained to them. So they want to keep getting better. They don't want to ever return to where they were. And
yeah,
because we've had these conversations in the beginning, they understand that their long-term commitment to doing the right things, making good decisions, taking appropriate actions is what's going to keep them highly functional throughout their lifespan. And I believe that they believe that when they're done, and they believe they can. Again, it comes back to if we instill the belief in them because we believe, then they're going to have much better outcomes as well. So they want to feel better and they want to stay feeling better. That's the
yeah.
real beauty of continuing.
Yeah, just to remind listeners as well, we've been talking about with Karen DeSimone, who's a physical therapist in Massachusetts in America, about her program, Freedom from Back Pain, and it's amazing how similar the ideas are in different parts of the world about what can be done in back pain, because there's so many things, and it's not a life sentence. It's something that can be changed, particularly if you give yourself the time and patience to be able to make a change as well. And last question today: someone doesn't have back pain right now, but wants to prevent it long term. What should they be doing? Where should they start? What would be should be part of their routine?
Yeah, that's a really good question. What should they be doing? Well, first of all, be honest with yourself. Are you taking care of yourself in a way that that is really setting yourself up for success? Meaning, I think people forget that they migrate to an area that they like, right? Either it's strength training or it's flexibility training or it may be a combination of activities, but you really need to make sure that you're including all of them, which should be, flexibility, joint mobility, strength, muscular endurance. So you want for a well-rounded program, you really want to include all of those things. So
Yeah,
go see your local physical therapist and you maybe get an assessment, but always be doing something in the areas of each of those to make sure that you are able to, having muscle strength is very different than having muscular endurance, right? Especially when you're talking about posture. So I think a lot of people don't understand the differences there. So make sure that if you do have an injury or something that you're not able to do, first of all, never give up and go see someone that can help you. Likely there is something that a local physical therapist can help you with. So don't buy into the three-letter word that begins with A and ends with E.
no, fair
Or
enough.
it ends with D.
No,
So
fair enough.
yeah, I don't know if I answered that completely, but I think that people need to understand that the choices they make contribute to the outcomes that they achieve.
Yeah, yeah,
And people want the outcome without the appropriate decision and activity. So be looking at yourself closely and ask yourself, am I doing the things that are helping me achieve what I want to be able to do?
yeah. And what I'm hearing as well is that people think they gravitate to what they like, not always what they need. And a lot of people we see as well, they do strength work or they do core stability work, but they don't often do both. And like you got to need both, whether you like it or not. Your body's going to say, "I need you to have good control, I need you to have good strength, and I need you to have good flexibility." Like whether you like it or not, you're going to need it at some stage in your life. So, and that's going to give you the best stand in a long-term outcome as well. So, usually what the biggest where the misbalance I see is where people have worked on one area, not the other, and there's a lacking of control or lacking of strength, whichever one they're not working on. And so they either got great control and they've got admin ability to have capacity to have good load, or they've got really good strength but no stability control. And so
I
there's excessive.
definitely believe that that's the case as well. They're overlooking, I call it the boring work, right? It's not the
Yeah,
sexy activity, it's the boring work underneath it, and without building that foundation, then they can't do the fun stuff on top of it. So usually it's the foundational work that people overlook or don't participate in that's really going to determine whether or not they're gonna be able to sustain it in the long term. So I totally agree with that.
yeah. Karen, before we finish up today, any last comments for the listeners you want them to know before we finish up today?
No, but I really enjoyed coming on today. Thank you so much for having me. It's so interesting about, people are people no matter where they are in the world. So we all have the same struggles and we are all here to help each other. So I appreciate you having me on today.
Great. Thank you very much. And it's really great to see that, even across different backgrounds and different parts of the world as well, as a health professional, we're all seeing a very similar picture and we're all trying to help people have the best life they possibly can. And the great thing is that, compared to 30 years ago, we've got the tools. We know what people can do and there are options for there to make a really big difference in your life. Karen, thank you very much for your time again. And yeah, really enjoyed the interview as well. Thank you so much.
Thank you. Have a great day.